Kite-Gilead CAR-T trial requires a failure of a BTK inhibitor or intolerance of a BTK inhibitor. Most of these patients have heavy bone marrow burden. Most of these patients have severe thrombocytopenia. And we have a manufacturing time that's around 2 weeks from the time of, so we have to take them off the ibrutinib to collect their T cells and then wait a couple of weeks. Again, we can bridge with a little bit of ibrutinib, but before we get into the CAR-T phases, we have to hold the drug again. These are patients who don't do well with drug holidays. And so in spite of this very rapid progression and very proliferative disease, you take off the drug, it gets even worse. And so it's very hard to build in these drug breaks to facilitate the collection and still keep your platelets over 50,000 and still keep the mantle cell from doing something it's not supposed to do. That's the real challenge in enrolling this population. There are trials that are going to be coming from Novartis and I think from Juno, I'm not sure, but that may allow sort of less of a holiday from the ibrutinib, which will improve some things. But remember, once patients are progressing, as I showed you, the median survival is around 2 months. And so how much liberty do you really have? One of the things that I like about Kite is it's about 2 weeks or so to manufacture, but if we're talking about a month-long manufacturing period in a patient who's progressing on mantle cell lymphoma, what will their disease look like from the moment you recognize you're progressing, you get them to their apheresis, you manufacture their CAR T cells, it may be a month and a half in. They may not be in the best condition, and it's going to be really hard to accrue them in that context, even if you can keep your ibrutinib going strong. And so we have to come up with something.